Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of August 30th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Alameda County now has 107,492 recorded COVID cases, and this is up almost 3,000 cases from when I reported last week. We also have 1,312 COVID-19 deaths in Alameda County, and this is up from 1,309 from last week. And vaccinations continue to creep up. We are now at 88.3% of those 12 and up with at least one dose, and 74.7% of those 12 and up being fully vaccinated. As far as hospitalizations, unfortunately, those have increased up to 231 people in the hospital, up from 202 when I reported last week. 69 of these are in the intensive care unit. And we never, of course, want to see hospitalizations increase. We know that deaths typically follow hospitalizations by several weeks or even over a month because the hospital stays tend to be longer and can be complicated. But I did want to point out that with regards to deaths overall, we really are doing considerably better. As you can see previously, on the lower graph, deaths tend to follow along with hospitalizations, and you see that big peak there from the wintertime surge. And although we are having a summertime surge and hospitalizations are increasing, we can see that deaths seem to be not rising at the same level. And this is certainly because of our excellent vaccination rates, and only because of our excellent vaccination rates. We know that treatment for COVID-19 has improved somewhat, not where we would like it to be, but we also know that most of the most vulnerable people have been vaccinated, and for that reason, we are not seeing such a sharp rise in deaths, and so that is a piece of good news. With regards to cases, we know that cases have certainly surged, and what I wanted to share with you here is a new piece of the dashboard for Alameda County Public Health Department. And on the left, they have broken it down by age group, so you can actually look at any or all of these age groups. And so the cases have now been broken out by age group for the first time on the dashboard. And so this is really helpful, and I am pointing out here the 5 to 11 year olds because of course school has reopened, and we know that this is the age group that is school aged but not eligible for the vaccine yet. And you can see that among 5 to 11 year olds, the cases have gotten higher in this surge than they've ever gotten before, even in the wintertime surge. So we're going to be keeping a close eye on this as time goes on. So I did want to talk a little bit more about treatment for COVID-19 because this is something that unfortunately, and I think to a lot of our disappointment, has not advanced as much as we would have hoped. We, of course, understand why the first and second and third priority had to be a vaccine. That is what is finally putting a dent in the death rate for COVID. And so that is positive, but we also know that that is not the only thing that we need to bring to bear in this crisis. And one of the things that we have to keep up on are therapeutics. And so how are we able to treat once someone gets COVID-19? And so up until now, the majority of treatment has been supportive. In other words, stay home and do your best. And if you get sick enough to go to the hospital, then that is when you receive treatment. And treatment in the hospital hasn't changed a whole lot since maybe about 4 or 5 months into the pandemic, when it became pretty well established that there's oxygen, there's steroids, there's potentially an antiviral called remdesivir, and then of course there is intubation and mechanical ventilation if someone does have to get onto a ventilator and be in the ICU. And really that regimen hasn't changed a whole lot. And so I think it's left us all certainly wanting something that we can do outpatient. And as I reported last week, there is an excellent outpatient treatment called monoclonal antibodies. I'll speak a little bit more on it in just a moment. And so, what else do we have to help us in case we get diagnosed with COVID 19? So, first thing I want to do is point out a recent advisory that came out from the CDC. It's the Health Action Notice uh, that has been put out to warn folks that there have been increasing prescriptions of a medication called Ivermectin that has not been shown to actually have a positive effect for COVID 19, but that nonetheless is being used. And in fact, there has been such an increase in the number of prescriptions and even in some overdoses because people have taken too large of doses, that the CDC felt it necessary to issue this advisory. So I think I want to preface this by saying that early on in the pandemic, nobody really knew what to do. And there was certainly a lot of effort and continues to be a lot of effort around what we would call repurposed drugs. And that means that we took medications that might have been used for other infections to see if there was going to be an effect against COVID 19, because that's obviously a lot faster than trying to develop brand new drugs from scratch. And there were doctors all over the country and all over the world losing patients left and right. And so it's understandable that there were a number of off label uses of medications that were tried in an effort to save lives. And this is how we came to realize that steroids were going to be the way to go. There was some conflicting data in the beginning. And then what we realized is that the guidelines just had to be refined. And what was important about steroids is that they were used at the right time and that they weren't used too soon. And so once that was determined, we now see that steroids are really the cornerstone of treatment when someone is sick enough to be hospitalized, right there alongside with oxygen. So oxygen and steroids are sort of the top treatments that you get if you're sick enough to go into the hospital. And mind you, that those are cheap, they're generic. There's no pharmaceutical company that's making gazillions of dollars off of them. But nonetheless, those are the cornerstones of treatment because they work. And there have been a number of studies that have demonstrated this very conclusively since then. Now, during that time, there was also use of repurposed HIV drugs, Ebola, and other infectious, anti-infectious drugs like ivermectin. And some of those studies, typically these studies will start in vitro. So that means we started in the lab before we're going to try it on humans. And then there was doctors that were trying it in different kinds of cocktails and things like that all over the world, because ivermectin is another cheap treatment that's highly available. And that's what we are all looking for, is some way to treat this horrible infection that would be quick. And so ivermectin was one of the medications, along with hydroxychloroquine, that both were actually shown in labs to have some activity against COVID 19. So that kind of started the initial excitement around these medications. But unfortunately, as we've seen with both of these medications, the hype sort of got out way ahead of the data and the information, and unfortunately turned out to be incorrect. And we have now a number of different studies of variable quality that are all coming up to show that so far we just don't have enough information to say that ivermectin is working. And there's quite a bit of data so far that is showing that it does not. Now, is it possible that at some point in the future we find out that if you give it on a certain day of disease progression, or at a certain point, or at a certain dose, or with something else, that maybe it will be useful? We don't know that yet. But I think it's important to note that it hasn't been ruled out for the future yet either, and that there are a number of large studies going on, one by the NIH, another at Oxford University in the UK. And these are large-scale, high-quality, randomized, double-blinded controlled trials that we hope will give us more information. But until then, there is no data to suggest that ivermectin is helpful, and it may in fact be harmful. So ivermectin is actually an anti-parasitic drug. So it is used for many tropical diseases, for scabies, for a lot of tropical diseases that occur all around the world. And it is generally well tolerated in the doses that are needed to kill off parasites. And as I mentioned, there was some early effectiveness established in the lab in vitro where they used humongous doses of ivermectin in order to suppress COVID-19. And these are doses that can't be tolerated in human beings. And so it may kill off some virus, but it may kill off some other important things that we need, and it may cause toxicity. And so this is really the concern, is that in that case, after those in vitro studies, which is how most of these studies start, then you got to go in vivo to humans and really look at how it's actually working and if it's really working. And so there's actually a very distinguished panel that is convened that you can take a look at through the NIH, but these are doctors that are actually from all over the country in different academic institutions that review evidence. And this panel took a look at the dozens of studies from around the world that are being undertaken uh, regarding ivermectin. What I wanted to show here is some of the information that has been put together and reviewed by the NIH on their COVID-19 treatment guidelines page. And so you can go to ivermectin and see that there's quite a bit of information here about ivermectin itself, what the proposed way that it works is, and some additional information. But what I wanted to really draw your attention to here is clinical data, and it actually shows a table of 16 of the many, many studies that have been done. But these are really the 16 that had the greatest impact on the panel recommendation regarding the treatment of COVID-19 with ivermectin. And so you can see here that it goes into some detail about each of the studies. And you can see over here they have the number of participants in the study, where it was done, and all of the different components of the study. And most of the studies are using not just ivermectin, but other interventions as well, which can actually make it a little bit difficult to assess what is doing what. And so over here on the right, it has some of the key limitations of each of the studies. And so I just wanted to share this with you because for those that are really interested in understanding the evidence or lack thereof, this is a really good overview of some of the highest quality studies that have been done so far on ivermectin. And so for those who are interested, I strongly suggest that you take a look. And so, what I would say is, because one of the things that I hear a lot is that, oh, the drug companies aren't going to make money off of ivermectin, so they're somehow suppressing information. And as I mentioned, steroids and oxygen, that nobody's suppressing that. It works, it's cheap, and we're using it. And there is nothing that the pharmaceutical companies can do to stop universities, physicians, and other researchers from trying to find cures. Now, will they fund large studies of something that they might not make money off of? Probably not. So that is a fact, but that has always been a fact. And so for those of us that work in this space, this is nothing new, but nonetheless, research is taking place. It does take place. And in fact, the drug company Merck that makes ivermectin even came out and said, stop taking it for COVID. It doesn't work. And so until we have evidence to the contrary, ivermectin is not one of the tools in our toolkit for COVID-19, and we will be reporting back as more information is learned. But as of this time, it's not working, and it may even be harmful. And people who are now resorting to taking huge doses and buying it from veterinary stores and others are not only potentially harming themselves, they're actually creating a shortage of ivermectin. And this is the same thing that happened with hydroxychloroquine, where We had patients with lupus who needed that medication and couldn't get it because there was a shortage. And the same thing is happening to some extent with ivermectin. And so this is, there's just no need because it doesn't work. So let's move to what does work. And so I want to spend a little bit of time talking about what to do if you do catch COVID-19 and things to consider. Now, I spent an entire briefing on August 17th talking about monoclonal antibody treatment. And so if you are interested in the details about that, please check that out. But essentially, monoclonal antibody treatment gives you a temporary immunity against COVID-19, against SARS-CoV-2, if you take it in time. So basically, you can see here on the left is getting the COVID infection without having any antibodies. Remember, if you've not been vaccinated and you've not had COVID before, you do not have antibodies against SARS-CoV-2. I don't care how great your immune system is. That's why we call it novel coronavirus. And so without antibodies, you're really just rolling the dice here of how you're going to do with this infection. And so with monoclonal antibodies, if you started in time, so before the COVID really has a chance to attach to all your cells and cause you these problems, you can take these antibodies and it will basically interfere with SARS-CoV-2 being able to attach to your cells. And so this has been shown to reduce hospitalization by about 70%. That is quite remarkable. And you really do have to take it in time. And that means within 10 days of symptoms, but really the sooner the better. And you must, if you get symptoms of COVID-19, then you need to get tested right away. So have that positive test and you'll be able to go ahead and get this outpatient infusion treatment. And there are so many criteria that make you eligible that pretty much almost everybody 12 and up who gets symptomatic with COVID-19 may be eligible for monoclonal antibody treatment. And again, take a look at the August 17th briefing if you would like to know more about that. Now, what else can we do short of monoclonal antibody treatment? So first and foremost, we need to monitor your status. So how are you doing and how will you know if you take a turn for the worse? So one thing I'm going to suggest is that we purchase a pulse oximeter. And if you are not vaccinated, I'm going to suggest that you have a pulse oximeter at home now. Because if and when you contract COVID-19, you would like to be ready. And we know already that the vast majority of people who are contracting it and doing poorly and going to the hospital and dying are unvaccinated. So that's who I'm really mostly worried about here. Although the things I'm saying also apply to those who are vaccinated and who contract COVID, I'm mostly worried about those who remain unvaccinated. And so if you can purchase a pulse oximeter and have it at home, and what I'm going to suggest that you do is actually establish your own baseline. And I'm going to tell you why this is important, because this is especially important for people of color in general. But the darker that your skin tone is, the more unreliable this pulse oximeter may be for you. And I'm even talking about the ones that they have in the hospital. So this is information that has come out very prominently in the last year or so. This is from the New England Journal of Medicine, Racial Bias in Pulse Oximetry Measurement. And what it basically showed is that African Americans were 3 times more likely to have a reading on their pulse oximeter that showed them to be normal when really they were dangerously low in oxygen. So this is alarming and concerning, and this is something that we have been working on, trying to figure out how do we fix this issue. But for purposes of today, let's suffice it to say that we should all know about this. We should be able to advocate for ourselves and we should be able to monitor ourselves. And so what I will say is that because the pulse oximeter uses infrared light that basically has to travel through the skin, and if you have pigmentation in the skin, then it can interfere with the reading. But that is an interference that will be there. And so in other words, if you get a pulse ox and see how you are when you're normal, then you'll kind of know what your baseline is. So normally we would tell people that if you go down below 94%, that we want to start getting worried. But I would say that we should also be looking at a drop. So let's say you get your pulse oximeter, you're perfectly healthy and fine, you don't have COVID-19, and your pulse ox is always 99, 100%. Then if you go down to 96, that's a 4 point drop, or 95, that's a 5 point drop. I'm concerned about that. If that happens in the setting of you having COVID-19. So I am not going to say use the absolute numbers of below 94, although that is a good indicator, but also a drop would also be another indicator. So getting a pulse oximeter, having it on hand at home is important, but certainly if you catch COVID-19, this is a good thing for you to have and to monitor. Now you want to make sure that you use it on your index finger or your middle finger, and that when you read it, that you see how there's the number on top, which is the oxygen. The number on the bottom is the pulse. And so you need to have a strong pulse signal in order to rely upon your pulse oximeter reading as well. And go ahead and observe the readings for at least 30 seconds, and you want to kind of identify what is the most common value that you're getting to sort of establish where you are. So monitoring how you're doing is super important, and if you catch COVID-19, I strongly recommend you go purchase a pulse ox machine from, any drugstore. So next, let's talk about vitamin D. I've talked about this here before, and I actually did a pretty comprehensive review of herbs and supplements that do have data behind them on December 22nd, 2020. And so if you want to check out that briefing, I go into a lot of detail. But vitamin D is something that actually does have some good trial data that shows that people who take vitamin D tend to do better with COVID-19. People who are deficient in vitamin D tend to do worse. And so we know that the vitamin D receptor is present on our immune cells, including our B cells and our T cells. And they are even doing studies to see if vitamin D could be used as a preventative measure for COVID-19 because of how it interacts with our immune system. And it is worth noting that about 40% of US adults are probably vitamin D deficient, and the rate is almost double in African Americans. And so it's really important that we go ahead and just supplement with vitamin D. I take vitamin D every day, and I do recommend it. Now, the amount to take is what is probably, there's not total agreement about this. And so we normally talk about the dose being 600 to 800 international units or IUs. Right now, most experts are starting to recommend a little higher dosage because we want to get people out of the deficiency zone. Now, if you are going to get your blood drawn, I do recommend you have your doctor check your vitamin D levels, and that would be a way to get a very precise dosing that you need. However, most people can go ahead and take 2,000 international units, and that will get most people out of the deficiency zone. If you're severely deficient, you may need more than that. But too much vitamin D can be toxic. It can interact with medications, and it can actually have a negative effect on your bones, making you more susceptible to fracture. So we don't want to be going over 4,000 IUs. So around 1,200 to 2,000 seems like a safe range. It might not be enough if you're deficient, but taking that daily is important. I would consider doing that regardless, even without having COVID. But if you catch COVID and you're not taking vitamin D, I would definitely start. You do not want to be vitamin D deficient and have COVID. So consider purchasing some vitamin D supplements and getting started on those right away. Next is vitamin C. And vitamin C is an antioxidant, and it basically scavenges free radicals. We know that it has some anti-inflammatory properties, and again, it's something that we don't want you to be deficient in. It does help prevent inflammation, and we now know that COVID-19 causes a profound inflammatory condition, and that inflammation is really what wreaks havoc on so many organs in the body, and why COVID-19 is such an unpredictable course for a number of people. And so, again, we don't want you to overdose on vitamin C. I would not be going over 1 to 2 grams a day, but 500 milligrams twice a day if you've got COVID-19 should suffice. The other supplement that's being recommended is quercetin, and quercetin also has very similar properties to vitamin C, being an antioxidant and scavenging free radicals. And you can take 250 to 500 milligrams twice a day of quercetin. Zinc is we know that zinc does have some antiviral properties. It has been shown to slow down the replication of RNA viruses. It is also another one that's under investigation. We don't have a ton of data on zinc and COVID, but there is enough that looks promising. It is a mineral. It helps the immune system fight off viruses and bacteria. And most people get enough zinc in your diet. So I wouldn't necessarily say that you have to go out of your way taking zinc every day. I do on every briefing recommend a multivitamin. A multivitamin is going to give you enough zinc in general, although people who drink a lot of alcohol may be zinc deficient. And zinc is something that you do not want to overdose on. So, and it's also a mineral that has different recommended allowances based on your age and your stage of life. Getting a good night's sleep is incredibly important. And so if you can get 7 to 8 hours of sleep a night, that is excellent. We know that some folks suffer with having trouble going to sleep. And if you are one of those people, then you may want to consider taking melatonin. So melatonin has shown some promise in terms of reducing the severity of symptoms. And there was actually a really large data set from the Cleveland Clinic that linked melatonin supplements to a pretty significant reduction in the likelihood of getting COVID in the first place. And in African Americans, the reduction was actually double, so 52% lower risk of catching COVID. Now, this is not cause and effect, so this is one of those correlations, but it was quite significant coming out of a very large data set. And it's not really clear whether it's the melatonin itself or whether it's the fact that the melatonin helps you to get a good night's sleep. Personally, I would probably only consider it if you do have trouble getting adequate sleep at night. And there's other things you should try around sleep hygiene to get a good night's sleep. And so those include making sure that you get some sunlight during the day, several hours of sunlight, so that when it gets dark at night, your body naturally produces that melatonin. So it is a hormone that we naturally produce. Some people just don't seem to produce as much of it. And for those people, taking a melatonin supplement before bed can be helpful. You really do want to be careful with the dosing here because you don't want to be groggy the next day. I would start at a low dose, like 1 milligram at bedtime, and see how you do. And then you can kind of go up slowly from there, no more than 5 milligrams per day. If you take high doses, it can have side effects. And so with all of these things, I do recommend speaking with your physician before taking them. But these melatonin, vitamin D, vitamin C, quercetin, and zinc, these are all things that are over the counter. And as long as you stay within reasonable dosage range, it should be fine. But again, if you have chronic conditions, if you are pregnant, if you are nursing, if you are taking medications, we want to make sure that there's no interaction. So please do check in with your primary care physician. But these are the things, and I'll just review them again, that if you catch COVID, the first thing you want to do is inquire about monoclonal antibody treatment. See if you are eligible and get a referral. This is something that the VIPs are getting. We know that President Trump got it when he got sick and he turned around quickly. And that's what we're oftentimes seeing. It basically stops the progression of COVID-19 in its tracks if we start it in time. Now, mind you, if you're sick enough to go to the hospital, it is too late to start monoclonal antibody treatment. So time is of the essence. We're going to want to monitor with pulse oximeter. It's great if you can get yourself a baseline of readings before you need it, before you get sick. Get a good night's sleep. If you do have trouble with getting good sleep, then you can take a melatonin supplement. And then in terms of the vitamins that we're recommending, it's vitamin D every day, up to 2,000 international units. Also vitamin C, quercetin, and zinc. Remember, the risk of dying if you catch COVID-19 is still about 1 in 56 if you are not vaccinated. Definitely, there's no question about it. The vaccine is the only thing that is reliably and consistently preventing hospitalization and death in the vast, vast majority of people. What we are seeing now with increased hospitalization, ICU, beds being taken up, is 97-98% among the unvaccinated. So there's no question that that is the number one way that you can protect yourself. Remember, if you have not been vaccinated and you've never had COVID, then you do not have antibodies against COVID-19. You don't have any memory to be able to fight off COVID-19. And so, really, vaccination is the main way you're going to protect yourself. If you catch COVID and you get symptoms, or if you've been in close contact, if you've been exposed to COVID and you are in a high risk category and you're not vaccinated, those are all indications for the monoclonal antibodies. So please don't assume that you don't qualify for monoclonal antibodies. If you've been exposed and you're high risk, or if you catch COVID and you have symptoms, you have a right to that treatment. It is free and it is being provided free of charge for now. And so please advocate for yourself or those that you care about who catch COVID-19. If you believe you were exposed and you've not been vaccinated, isolate yourself, get tested in 3 to 5 days, and continue to isolate until you get your results. If you get COVID symptoms, get tested right away, even if you're fully vaccinated, and isolate until you get your results. If you test positive, please do what you can to get your close contacts to get tested and isolate themselves as well. And please inquire about monoclonal antibody treatment and follow the guidance that was contained within this video about how to care for yourself. And for everyone, to optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10.